Hi, everybody. Welcome back for another one of our guest speaker series today. I am excited to have Dr. Melanie Pelichia with us from the University of Pennsylvania, and she has some amazing projects that she's working on. So as we learn more about her and her journey into NDBIs, I'm hoping that she'll share some information about that. Hi, Melanie.
Hi, Jamie. Thank you so much for having me. Really excited to be here and talk with you.
Yes. Can you tell us a little bit about where you're at, what you're doing, what you've been doing, where you think you might go?
Sure. So like you said, I am at the University of Pennsylvania. I am in the Center for Mental Health, which is in the psychiatry department at Penn. And so our center, just to give you a broad sense of what we do in our center, we are broadly focused on community-based implementation and evaluation of what is considered evidence-based practice for individuals with psychiatric and developmental disabilities. And so what that really means is thinking about what is identified and proven to be effective, and how can we translate and implement those things into the real world, into the real world communities. And so we have faculty here who work on lots of different areas of the population. And so people who are anxiety treatment experts, people who are epidemiologists, people who are economists. And then we have a whole autism focused team, which is where I sit. In our team, we do research, and we also have some clinical programs. We have an early childhood program that is a therapeutic preschool program for 3 to 5-year-olds on the autism spectrum. That is a group-based NDBI model. We also do a lot of school-based consultation for the Philadelphia School District, where we have a team of consultants that have been working in partnership with Philly Public Schools for maybe 15 years now. It's been quite some time, providing consultation and support to teachers who are working with autistic students in the public school system. And we have a whole cadre of research projects that are focused on different areas of autism research, intervention, implementation in the community. And so that I support the early childhood program, but my colleague Megan Kane directs that and does all of the hard work related to the day-to-day stuff. And my work is mostly research now, and focused on how to improve high quality implementation of things like NDBI in community publicly funded service systems.
Yeah, and before we started recording, we talked briefly about the work you're doing with early childhood intervention, but I would love to know more about the preschool program. I have a preschooler, so I'm always curious. So that's an inclusive preschool setting, small group, NDBI, data, outcomes.
Yeah, great. So it's not inclusive. And so we do have plans to build an inclusive preschool program. Right now, this program is funded through Medicaid. And so it is for children who are Medicaid primary. And so we're really excited and grateful for the opportunity to serve a population of children who often are left out of high quality evidence-based care. And so the children who are served in our early childhood program are there full day. So 9 to 2:30. It is a group model that's intended to prepare them for a more inclusive or community-based placement. And so they come, it looks like controlled chaos. Sometimes more controlled than others, where we're really following the children's lead. It feels like a party when you walk in the door. It's intended to be, whatever the children are into and motivated to do and excited to participate in is what we're doing that day. And that changes from minute to minute. Day to day, really focused on, trying to get them ready for a school-based routine. And so, for example, we'll have circle time, but our circle time might be 3 minutes long, as opposed to the traditional, circle time's 30 minutes because that's what the calendar says, that's what our schedule says. If kids are not feeling it today for 3 minutes, and we're following their lead and we're trying to build on success and strengths, and we'll quickly transition to something else in order to keep their motivation and their engagement, as opposed to saying, we have to do circle for 30 minutes because that's what's on our schedule. And so that's kind of what guides the structure of the day. It's really focused on child-led interaction with structure and routines
Yeah.
overlaying that, of course. It's certainly not a free-for-all, because that would be really difficult.
For
um,
everyone.
yes, but it's really focused on what is fun, what's engaging. It feels like a really fun, happy 3 to 5 year old party, as much as we can.
I love that. When I was at Ohio State, Professor Koop was talking about McDonald's. He used to tell this story. This is like 20 years ago, so I'm going to paraphrase this. McDonald's and children coming to learning and the McDonald's, and it was a party and everyone celebrated when they walked in the door. And he was just so passionate when he made this story that I'm really having a hard time remembering. But it was kind of like what you're saying, like it's fun, come in, learning is exciting, and we're here to support you. And your story of a party really makes me think about what Coop was talking about, the arches, and how much fun education can be in learning. And last month, I did a webinar for the group, and it was about setting up, supportive environments. And the clinic that I had in Vegas was a play school, is what we called it. It was like
Mhm.
preschool, and we had routines and transitions and everything set up because our goal, again, not inclusive, was to get these young children in and to get them into an environment where they would be successful. So we transitioned every 15, 20 minutes. We had
Mhm.
structured group. We had one-to-one. It was a one-to-one ratio, but we did group stuff
Mhm.
within the ABA kind of
Right,
umbrella of billing.
right.
But it was wonderful to kind of have that for parents to see, this is what we're doing because this is where we want the children to go by next child on the wait list to come in. And it was just
Exactly.
phenomenal, and I
Yeah.
want to get them in there. So that's so exciting to hear that. And I'm just thinking replication of your preschool group model. One of the things that I have not seen research in is NDBIs within Head Start.
Mm.
I don't know if you know of anything. Tell me if you do. So I have a colleague in Vegas who's high, high up in early Head Start and Head Start, and we have been talking about research. And I'm wondering perhaps if I could connect you to see, he's a BCBA now, if we could figure out how to get some type of an NDBI research project in the Head Start or early Head Start setting. Because when I checked a few years ago, I had not seen any research in that particular service delivery setting. Can you
Yeah,
think?
I don't know of any either. I think it's certainly something that's needed for early childhood education settings, whether they're Head Start or other kinds of early childhood education settings that are community-based providers, right? I think this is something that is really, um, I think it's, these kinds of NDBI group models are not only helpful for the children with autism or social communication delays, but for all kids in the classroom. And it's really focused on like building a community, building routines, building a really fun, engaging party-like environment that's focused on lots of opportunities for language development, rich engagement, and those are things that are just really good for development overall.
Yeah,
Uh, so I
yeah,
think it would be amazing to,
yeah. I'm going to connect you to Dr. Rory. You're going to get an email. Future
yeah,
project collaboration. I can see some beautiful, beautiful research opportunities that are always looking for that. And we had spoke of that. So I really think this could be a beautiful research project. I'm not really in the group setting with communities, so I'm kind of on the outside, but now I have an insight. And you were talking before about the research that you were doing with the early childhood. Talk about the scale and the scope of that project for training the paraprofessionals and the number of children you're following, because that's staggering to me. It's huge.
Sure. Yeah, happy to. And so I have a new large scale project that's funded through IES, so the Institute of Education Sciences. It's a 5 year project. We just wrapped up year one. And so we are really, elbows deep in all of this great work that we're doing. And so I'll give you a little bit of background in terms of what led to this project. And so this project and most of my research, if not all of it, is community partnered,
Okay.
meaning that I'm working directly in partnership with the people who are receiving or delivering or administering, community-based early autism intervention. And so here in Philadelphia, there is a 0 to 3 infant and toddler system, so the Part C funded system. And then when children turn 3, they transition to a 3 to 5 preschool program, which is funded through an entity called Elwin. And so this project, and just in terms of scale, in Philadelphia, it's a large urban city. It's a large urban city that has really high poverty rates. It's the poorest large city in the United States when you think about just some general demographics. And so I think that's important context to think about the challenges that are often faced when implementing, high quality ABA, NDBI based programs in a real world setting like Philadelphia. And so I've been partnering with the infant and toddler system here in Philadelphia for quite some time now to think about how we can better disseminate high quality evidence-based programs for kids who are either on the autism spectrum or have a high likelihood of having an autism diagnosis. And so we selected, largely driven by Philadelphia's EI system, Project Impact as being the model for implementation within Philadelphia early intervention. And so Project Impact, I know you're familiar with, Jamie, but for those that aren't, it's a caregiver-mediated naturalistic developmental behavioral intervention. So a caregiver-mediated NDBI that includes specific strategies for working with children that are NDBI-based strategies. And it also includes a whole process of working with caregivers and coaching caregivers on how to implement these NDBI-based strategies with their children. We did a lot of community partnered work to land on Project Impact as the intervention that we felt was a good fit for Philly. For many reasons, it is manualized. It has a clear scope and sequence. The manual has lots of visuals, lots of pictures, lots of tip sheets that we thought would be attractive and easy to follow and feasible to implement in a large scale in a large urban service system. And so we started to train some providers in Project Impact in partnership with Brooke Ingersoll at Michigan State University, who is the developer of Project Impact. And we studied how it went. We studied how the providers who were being trained, who work in this public service system, were implementing it. And we studied how the families and the children who were receiving it were doing. We were lucky to receive a pilot grant from the Eagles Autism Foundation here in Philadelphia. So from the Philadelphia Eagles, they have a wonderful foundation, and they funded some additional pilot work where we were able to train providers and follow them for 6 months and see what did that look like. And we learned a lot from that pilot study. We learned that the providers, despite having substantial training and support, often did not implement the program with fidelity, meaning that they weren't doing Project Impact the way that it was written in the manual. They were kind of picking and choosing which components they wanted to use. And most often the components that they were not using were those caregiver coaching components. And so they were more likely to go in and work directly with a child, work on play skills with the child themselves. Mom or dad or caregiver might be in the room, but they weren't coaching them using directive coaching strategies and how to use those skills. And so the parents weren't learning them because they weren't getting the active coaching. What we saw was that when the providers were using the program with fidelity, their children and families had much higher gains in social communication outcomes after 6 months than when those providers weren't using the program with fidelity, which helped us understand we need to improve fidelity. And these are not brain, storming ideas. These are things that were expected. We know that when programs that are tested and developed in university-based settings and tightly controlled clinics in a really pristine ABA clinic, for example, gets implemented in the real world in someone's home with a provider who doesn't have all of the training and support that you might get at a university, there's a lot of drift. And so we expected these kinds of things to happen. And so I developed a toolkit called PEACE. It's the Parent Empowerment and Coaching and Early Intervention Toolkit, that is really focused on the caregiver coaching aspects of a caregiver mediated intervention. And so coming up with strategies that were based on things that we saw as barriers to using the program. So in Philadelphia, EI, and this is the case for many EI settings across the country and across the world, I would assume, you go from your morning child to your next child's house, to your next child's house, kid A, kid B, kid C. You don't have a lot of contact with your peers because you are, leave your house, you go do your home-based therapy if you're working in kids' homes or preschool settings, and then you go back home at the end of your workday. There wasn't a lot of opportunity for ongoing training and supervision and support. There wasn't a lot of cohesion and connection among providers, and they reported these things as a barrier.
You work
Also,
out of your trunk, right? You got the trunk.
yeah, you bring your toys in and you go to the next kid's house and you put them back in your trunk and
Your
you have
lunch in your car. Yep, I've been there.
absolutely eating on the go, spilling coffee on yourself as you're going to the next kid's house. I've been there many, many times, and I remember those days for sure. And so part of what we tried to do was develop a toolkit that would address some of those barriers and build a community related to the use of caregiver coaching within early intervention, with also targeted training and consultation and support. And so we were funded, like I said, by the Institute of Education Sciences to systematically evaluate the use of the PEACE toolkit while training providers in Project Impact throughout the city of Philadelphia. And so we're training 200 early intervention providers through this project and randomizing them to different levels of implementation support from the PEACE toolkit. So some providers will get access to online resources. Some providers will get access to group consultation, and then some providers will be randomized to receive individual consultation. And part of what we're wanting to assess is how much support do people actually need to be able to do this kind of program with fidelity. We think some providers might just need online resources. Some providers might need group facilitation, and there could be some providers that need a little bit more support. And so we might think about using individual consultation for those providers who need a little bit more support. And so we're looking at what are the characteristics of the providers, and how does that relate to their fidelity? And then also, what are the characteristics of the children that they're working with? And how does that relate to their ability to use this kind of program? We're enrolling 400 children and following them each for 6 months and looking at family and child outcomes who are working with these providers. And so we're doing that right now. I have no results to share because we are in the middle of implementing the project, but it's very exciting and super grateful for the partnership we have with Philadelphia's early intervention system. And really, I think if this project goes as planned, it will be one of the largest trials of behavioral intervention ever conducted. It's certainly the largest in a community-based setting. And so we're not working in a lab, we're not working in a clinic, we are working directly in Philadelphia. And so we're enrolling the people who work in Philadelphia. We're enrolling the children who are receiving public education, public early intervention in Philadelphia. The goal of all of this work is to implement these things in the real world and figure out what can we do to make this accessible to more kids and families, not just the kids that usually participate in research, right? We want this to be the kids who are getting this usual publicly funded early intervention.
Those demographics. And it makes me think about when you're talking, I've been really sitting down and trying to look for literature on responders or non-responders types of intervention from looking at a child outcome perspective. And I think Laura Schreiman has an article from back in the day from PRT, and then they did another replication of that. And I just saw one come out from ESDM predictors of responders, non-responders. But I love what you're trying to do and really look at those active ingredients of, is it the online module? Is it the coaching, consultation coaching component? or individual. And
Right.
what is that? So you can quickly maybe try to find a profile for this type of a staff working with this type of a
Right.
child.
Right.
Get them in this type of a support to quickly get
Exactly.
them to fidelity.
Exactly.
There's so many moving pieces and characteristics and demographics that, it's what is that, a riddle wrapped in an enigma, right? Best of luck to you.
Yeah. Yeah.
But I love where you're going and getting that feedback from those providers of what is it that really, what's the secret sauce? What is
Right.
it that makes them get to fidelity or helps them get to fidelity so that the work they're doing is more impactful in an effective, efficient way, and that it's generalizing across kiddos, or this works really well for this type of a child profile, this type of a child profile. And I talk about them like diverse learners.
Hmm.
I see them around 4 and 5. Level 3 autism, no functional communication, not like some of these kiddos that have just been hanging out on wait list and they come in
Yeah.
at that time, that's a different child profile to work with.
Right.
These strategies might not work because it's a different
Right.
profile, right? So I love that you're really looking at the child characteristics as well to try to figure out how to best make it all fit together to support that implementation, but also the fidelity of
Yep.
the parent coaching. And really interesting that the providers are skipping out kind of on the active coaching part and just let
Mm.
me show you and do you.
Yeah.
That's great.
Yeah.
That
Yeah.
doesn't help a parent. So
Right.
that's interesting
Right. Right.
to have that toolkit to help kind of support. I feel like coaching parents or coaching and supervising staff could be its own subspecialty micro credential.
Hmm. Yep.
It just
Absolutely. Yeah.
knowing what to do and then being able to show somebody how to do it is two different skill sets. So
Yeah.
that's fantastic that you guys are trying to piece out the barriers and really get down to the roots of it to figure out is it a confidence issue? Is it a skill? How do we get them to be more of an active parent coach?
Yeah.
And why?
Totally.
Yeah. That's
Totally. And everything that you're talking about are things that led to this, right? And so we
um,
fully heard from providers like I went to school to be a speech pathologist, or I went to school to get my degree in ABA, and I learned how to work with kids. Like no one taught me how to
yeah,
work with adults, right? And so that's what, like, it makes sense then. Of course you're struggling with the
yeah,
coaching aspects because that's not what you were taught when you were in your training program. We don't get support in how to
no.
teach adults. And there's a lot of work we pull from the theory on adult learning theory,
Yes, yep.
to really guide the coaching components of this, because teaching adults is different than teaching a preschooler, right?
Yeah,
And so thinking about like using things like collaboration and making sure that you're partnering with the caregiver and they have a true partnership in this experience. It's not you coming in and saying, do X, Y, and Z things. It's like, what do you think is an important skill? And what would be hard for you to do this? Because if we don't ask those questions to caregivers, they're probably not going to do it because, as parents, we know it's hard and we have to do laundry and make dinner and work, and
yeah.
we weren't trained. Most parents didn't go to school to learn how to support their child. And here we are now saying, do this kind of approach with your child.
Yeah, I find that really interesting. So Liam is our only little guy here at home, and we don't have a point of comparison other than a couple of neighbor kids. And I always think and reflect on, are you just being four, or is that some of the autism popping through? Because I see the neighbor and no autism over here, but I see some things and I'm like, I think that's just being four, right? So I don't have that from a parenting perspective. Should we be doing this? I'm a behavior analytical background, a lot
Sure.
of understanding of child development, coaching parents from, 30 years of doing this. But as a parent, like it's sometimes really hard, very often overwhelming. And I just think that's parenting
Yeah.
in general.
Yeah.
So I
Yeah.
appreciate from a parent perspective that you're looking at how to support parents and really build into their existing routines as opposed
Right.
to asking them to do one more simple activity,
Exactly. Yeah.
one more thing on top of the
Right.
laundry, the dishes,
Right.
hard day at work, just thinking about getting the kid to
Yeah.
bed, the bedtime routine
Yeah.
struggle. So I appreciate the sensitivity of that to support parents and identify those little pinpoints and barriers that might make a parent not want to do something, even if the payoff would be it's going to be easier and better down the road. It's just getting over that kind of a hump and getting the strategies and accessing the reinforcement for the parent's behavior to be the change maker and to keep seeing that happens. And we know
Yeah.
that time and habit, right? Like it's
Yeah.
not a quick, immediate gratification. And I think a
Yeah.
lot of parents can just quit and give up because they don't
Right.
see the payoff right now, even though you're
Right.
laying the foundation. So that's hard. And that's human behavior, right? We're
That's
teaching.
human behavior. Absolutely. Yep.
Yeah, I
Yep.
appreciate that very much.
Well,
The
thanks.
nuances. Yeah.
I think it's hard to, we spend a lot of time hearing from providers in our consultation sessions, and they'll say, well, Project Impact has a parent manual in addition to the provider manual. And you're supposed to give some homework to do. Yep, there it
Yeah,
is.
right there. The old one, sorry. I have the new.
And they'll say, well, mom didn't read the chapter that I asked her to read. Well, that's going to happen. And so
Yeah.
that makes sense, right? And what are you doing now to help
Yeah.
mom? And maybe reading the chapter is not accessible. Maybe that's not the right thing that she needs to
The
be told
modality. Yeah.
that she, is her homework. Maybe it's a matter of like practicing during session and practicing in the routine that she's more likely to do, because everybody has to get dressed. And so maybe practice during getting dressed or whatever it might be. But those kinds of things and meeting the parents where they are, I think,
Mhm.
really goes a long way.
Yeah, just
And
like the kids, right?
yeah, yeah, yeah,
Yeah, that's really interesting. What made you get into NDBIs, or what inspired you down this road?
yeah, yeah.
It's been in a
So
while.
it's been a while. I've been in this field for 25 years now, and started in a traditional ABA discrete trial world. And I think that's probably what everybody was doing 25 years ago.
Yeah.
At the time, it was certainly the state of the science in terms of autism intervention. And I loved it. I loved working with kids and families. I loved um, the the change that was evident in many of the children that we were working with related to learning lots of really important skills when we were using behavior change strategies.
Mhm.
Um, I think, as I went on in my training and in my approach, I ultimately ended up going back to school once I had a terminal master's and was a BCBA, practicing as a BCBA for many years, developing programs here in Philadelphia, um, realizing like there's something missing. And also at the same time, not just clinically, but also thinking about, there are so many families who are not accessing this kind of approach. There are many families who need it, who aren't getting it. And often the families who are getting it are the families who know to advocate for it, know what to ask for,
Sure.
know what words to use when they're in their child's IEP meetings. And there are so many families, for many reasons, don't fit that profile. And often from, what I was seeing is that they were the ones getting left out of this kind of, high quality evidence-based ABA approach.
Yeah.
And so I went back to school, got my PhD, ended up becoming a licensed psychologist. And in that time, did a lot of learning about child development, a lot of learning about, how children learn, learning about family systems, and was trained in PCIT, so parent-child interaction therapy, which is parent coaching program for young children, not just with autism, not with autism, but children with more like disruptive behavior disorders. And when I was getting trained in PCIT, I was so struck by the caregiver coaching parts of that, and really was thinking like, why aren't we doing this more with kids on the autism spectrum? Thinking about all the families I had worked with and how that could have supported them. And at the time, becoming a new parent myself,
Mm,
and thinking about, like,
living it.
yeah, there's all of these things happening and how hard it is to be a parent, and how we would, say to mom, never give in. If you give in, that's going to reinforce every tantrum. And like, that's bonkers. Of course you're going to give in. You are tired and
Yes,
you
ma'am.
need a break. And, and so just understanding that both
Mhm.
personally and clinically, all at the same time, I think kind of led to exploring more about what kind of caregiver supports are available for kids on the autism spectrum, really learning about programs that are caregiver mediated, like Project Impact, Jasper, ESDM, all of those kinds of things. And really seeing the benefits of a more child-led, developmentally oriented approach to intervention for young kids. And you learn so much more when you're happy than when you're not, as a human being. And thinking back to when I was using a more traditional compliance focused type of ABA based approach to instruction, how, like the use of an extinction based procedure for challenging behavior, that's not something that we use in our program. And we really are focused on prevention. We're really focused on motivation and enhancing engagement, and really thinking about that relationship between the child and the caregiver, the child and the therapist. And everything that we're doing is in service to that. And we're seeing the gains in children related to they're happy, they're engaged, they're communicating, and then all of the other things, hopefully come. But we're looking at it through a different lens, and really focused on child development, developmentally appropriate practice, preventing challenging behavior instead of intervening on challenging behavior after it happens. All of those things, I think, were the things that led me to this NDBI inclusive approach, incorporating caregivers as primary partners in their child's intervention. That sort of long 25-year journey.
Same journey. Yeah, when I lived in Iowa, and then I went to college and then moved around the world, and now I'm back in Iowa, full circle. Same thing. There was nothing back in the late 90s. And so CARD would come out from California. And I remember being in the father's office with a little desk and table, stand up, sit down, stand up, sit down. And I remember talking to the consultant. I'm 19. I'm not going to question him.
Right.
Why does he have to do this 10 times?
Yeah.
I'm really struggling with this. And then trying to do a block program. This kid had no communication. He was 3.
Right.
I had no clue about child development at the time. I was just in an ABA internship from a psych undergrad course, and I loved it. And
Same
sometimes
start.
he would cry. He'd run up and hide under the bed when Miss Jamie would come. And then at one point I went to find him, and he was upstairs in this glorious playroom. And I was like, why can I come up here? Yeah, you can go up there. So we stopped shutting the door in the home office, and we went into this gorgeous playroom. And you know what happened? Change. It was amazing. And I just feel like you need to reach before you teach, right? I needed to have this connection. And I just remember during our last sessions, he'd run to the door to greet me, right? And it's totally different routine, not just for him, but for me. But it also made more sense. Why would you keep, he would kick and cry. I'd kick me too. Like, well, you want me to stand up 10 times? Girl, I might get out of this chair 2 times, and that's all I'm giving you. But I understand that so much more. And then the more I think you learn about child development,
Right.
and I really feel like with NDBIs for ABA providers that are really coming into this beautiful field that we have, that big D, like really getting them to understand child-centered, child-led, child development is the biggest struggle that they have, and implementing all of the strategies that work against it, the extinction and hand over hand. I don't think you need to do that if, again, environmental arrangement strategies, motivation, attention, you don't really need to get there. Something is off if you're at that point in your teaching relationship. And that's how I viewed it from 30 years ago. And I had no idea what I was doing back then.
Right.
It didn't feel right. I didn't feel happy and comfortable being in that scenario.
Yeah, I totally agree. I remember going to a training, early on, and having and I tell this story often, the trainer saying, like, this kid should be looking at you like a giant chocolate chip cookie. They should be running to you, not away from you. And it was such a light bulb moment. Like kids would run away. And you would think that's expected. But we also were trained like, well, that's because they don't want to work. Right. And that makes sense. They don't want to work.
They shouldn't be working, they're children.
Exactly. Yes. And so it's not work, it's play, and it should be fun, and it should be engaging, and it should be that we are giant chocolate chip cookies that are really attractive and tasty, and they want more and more of us, right? And that's often not how intervention was looked at before.
Yeah, I used to work for Dr. Partington, and he had, when he was, I think Betty Hart was his mentor, and he talked about being a great big giant green M&M coming in the door. Same thing to kind of get there. But also, we see, I'm sure you've seen it too, people that are trying to run like these cars. What is it? The kid is
Yeah,
on the floor under the table, and you're stop.
yeah,
Pivot. There's like, but they have to follow a protocol and get that data point. And I think what you measure matters. And that is something off. Like that to me needs to be measured from an attention, motivation, connection perspective.
exactly.
What
Yeah.
you can't teach someone when their head is facing away from you, right? So yeah, I think
What is the usefulness of that? Like, why is that even something that we're working on?
yes, the priorities of the interventions, I think within NDBIs, what we're trying to do from social communication, interaction, foundational skills, that maps on to the DSM-5. I know within the ABA medical model, we're remediating deficits related to, and I know there's some pushback, whatnot on that from the neurodiversity community. But I love what you said about, even we're stretching strengths. We're really trying to build on that. But there are areas of need and barriers and weaknesses that we also need to work on growing. Like we
Yeah.
can't just leave those unchecked. So I feel
Yeah.
like NDBI is just such a good holistic, and I know that might be a little granola, like a holistic approach to supporting children. And I really feel like it's the D that's been missing from the ABA kind of.
Totally agree. And I think, we've been working hard to try to disseminate knowledge of NDBI to more ABA oriented people. We have the NDBI special interest group as part of ABAI that I know you are familiar with and a part of, and really trying to help more people understand the importance of this kind of approach, not just for young kids, but I think for
Right.
anyone. And I think the idea of that D is so critical and so lacking from ABA training, but I think critical for people who are working with children, regardless of what your discipline is. You should understand child development if you're working with children.
Preach. I have no comment. Yes, I feel it's unethical. Like if you went to support an older individual geriatrics, you would
Sure.
expect to have some kind of experience. And if you are working with children with autism, I know a lot of technicians don't get even training on what is autism.
Right.
As a speciality, I always think like from a medical model, if I had a type of cancer, I would go to the doctor who dealt with that type of cancer, not a general one. So if we have a child with autism or an autistic child, however you say that, and they're young, there's a
Yeah.
specialty, and then they're
Yeah.
young is another specialty or subspecialty. And I
Right.
think from what I gather from some of the individuals I've done trainings for, I am presuming that their viewpoint is a 2-year-old is just a smaller version of a 4-year-old.
Mm,
No, there is a drastic developmental change between 2
right.
through 4, right? So that's why I feel like I see these programs just, oh, they're 2, they can do it. No,
Mhm.
they shouldn't even be doing it
Right.
development at that point in time.
Right. Working on like word recognition or something. Yeah. Yeah.
Yeah, what's missing? A developmental
Yeah.
background, an
Right.
understanding of development. So
Yeah.
many of the reasons I see children that are dysregulated, it's an adult's fault. You have unrealistic expectations of this small child. Stop, pivot. That's the problem. Don't go into all the other intricate behavior. You don't need stop and re-pivot your
Yeah.
priorities. Like that's where anecdotal or preventative, you're off here. And that's
Yeah.
where it's all trickling down to this hot dumpster fire that we have to put
Yeah.
out.
Yeah.
Why don't you just not start the dumpster fire in the first place? I appreciate that as well. So you kind of talked about the NDBI SIG, because one of my questions would be, where can people find out or stay up to date? And that's a great place to do so, is to kind of get updates. We have the NDBI website now that looks
Yeah.
great and updates with research articles and events and about different models. Do you guys have anything at the university that would be a resource to direct people to, or any of the projects you're working on? I'm trying to think of resources to kind of cap on what we've talked about today.
Yeah. It's a great question. So we have most of our work is focused on like teachers and providers who are working in these public
Mm,
service systems. And so I do have a colleague, her name is Dr. Julie Worley, and she has developed a whole series of micro trainings that are focused on, Autism 101, ABA 101, classroom-based instruction 101 kinds of things. They're brief, easily digestible kinds of trainings that, if anyone were to come to the Penn Center for Mental Health website, Penn CMH website,
Okay. They would find them.
They would poke around and find them through our Philly Ames site. And so we have a team of people that Dr. Worley leads called Philly Ames that are really focused on that school-based consultation. And they've developed these micro trainings that they're using, not just here, but internationally, in terms of providing support to providers. So that's a great resource, not just NDBI, but general autism kinds of information that you were just alluding to as being something that is really helpful. In terms of our university and our center, we do a lot of partnership with Children's Hospital of Philadelphia and the Center for Autism Research, and they have a series of workshops called Next Steps that are focused, again, not just on NDBI, but just on autism information in general. And so Next Steps for newly diagnosed parents, next steps for adolescents, next steps for adults on the spectrum, and really providing, just an overview of information that's helpful at each stage of the individual's life and their family's lives. And those are available either in person or they've been live streamed, and people have been joining those, from all over the world as well. And that's a great resource as well. I think in terms of like broader NDBI things, I think people who are interested in learning more about NDBI would definitely recommend going to the NDBI Special Interest Group website. It is definitely rich with resources, lots of information about different NDBI models, lots of links to research articles, lots of links to different textbooks and manuals that are available from different intervention developers. And so that's a great resource. And then the NDBI conference that you are spearheading, I think is a really important resource that I would absolutely recommend people attend. And the lineup of speakers is amazing, and it is sure to be 2 days of
one of them
NDBI content that I think will be really, really useful.
And I'm going to provide a link because you have a webinar at Behavior University.
Yes, thank you. I forgot about that.
Yes, I'll put a link for that so people can go look into that if they want. So when we wrap up here, I'm going to try to find these links and I'll confirm with you via an email. Am I directing people to the right place for the hospital and Dr. Woolery's work? And if not, you just correct the note, go here. That way I can get them where they need to go. Those are fantastic resources. I appreciate you sharing them and just disseminating and moving the needle over to NDBIs and community settings. That's brilliant. I think preschool is great. And I think supporting families in the home is great, and trying to get ABA providers in these kind of staunch, sterile clinics to really kind of change it up a bit. But I really think the work you're doing in the community with the population that you're serving is so impactful. And if it can work there, it can work. Do you know what I mean? Like,
yeah. Well, thank you. Thank you.
Yeah, you're welcome. Thank you for joining us today. It's been great having you on.
It's been my pleasure. Thank you so much for having me.
You're very welcome. Okay.